Welcome back to the podcast. I'm Tracy Donegan. Today I'm speaking with Dr. Phil Harrington, a graduate of Iowa State University with a degree in physics. Dr. Phil has been in private practice for 10 years and has served as medical director, clinical manager and laser safety officer for Sumus Medical Laser for 17 years. Dr. Phil's passion has made him a sought-after national and international lecturer on photobiomodulation, laser therapy, science, physiology, safety and clinical applications. In this episode, we discuss his experiences of using laser PBM. We chat about using laser for fertility, women's health in general, and how laser is making breastfeeding less painful for new moms. And now I bring you Dr. Phil Harrington. Hi everybody, you are very welcome back to the next episode of the Tracy Donegan podcast. And today I am delighted to welcome Dr. Phil Harrington, who is probably one of the world's leading experts when it comes to class 4 laser therapy. So Dr. Phil has agreed to join me today and I'm so appreciative of his generosity of time and knowledge. And one thing that I love about Dr. Phil's work in this space is about being able to tailor the care for the people that we're working with, which is so important. If we're thinking of laser and light and the impact it's having on our biology as being medicine, which it is, we need to understand what is the dosage? What are if you're coming for one issue and then maybe around fertility, if you're worried about recurrent implantation issues, or you have unexplained fertility, there is so many different parameters, different dosage, different treatment plans based on what your specific fertility challenges are. But Dr. Phil, welcome. Thank you so much for joining us today. Please take it away. What is a class 4 laser?
Tracy, I'm just thrilled to be joining you today. I'm so glad that we met online a few weeks ago, and we've had some really fun interaction back and forth about photobiomodulation and laser therapy and LEDs and everything involved there. And so thanks so much for giving me some time to chat with you and your podcast viewers and listeners today. So my journey started actually as a physics teacher. I started out my professional career as a high school physics teacher many years ago. And then I did that for a few years. I really enjoyed it, had a wonderful time with it, but just kind of looked around and wanted to do something else. And I actually have an older brother who also was a teacher, and he became a chiropractor. And so I saw what he was able to do with his hands to help improve the quality of life of his patients in his chiropractic office. So I followed him and went to Palmer College of Chiropractic in Davenport, Iowa, and became a chiropractor. And then in 2002 in the US, 2002 is when the first therapeutic laser device was FDA cleared. And then in December of 2003 was when the first class 4 laser was FDA cleared. And so kind of that combination of a very interesting tool of physics, the laser, combined with the very interesting tool of using hands to improve health of our patients chiropractically, it was kind of a natural fit for me. So I started to use some different types of lasers in my chiropractic practice, and that would have been around 2005 and 2006. And I always reflect back, and I think back to then, and honestly, Tracy, we had no idea how it worked. That there was really no explanation. All we knew was we would turn the device on, we would shine the light on the patient, they felt better, but then more importantly, they went to the front desk and paid, and then they came back for more care. So I am so grateful to all of the researchers around the world. We have many intelligent researchers, and I think it's always important to stand on the shoulders of the giants in photobiomodulation. And some of those would be Tina Karu, the Russian physicist who is the godmother of laser therapy, Michael Hamblin, who had done a lot of great work at Harvard Medical School and the Wellman School for photomedicine, Dr. Praveen Irani at the University at Buffalo, and many others that have done fantastic research so that now today in 2025, when we are asked the question, how does this work? We can actually give a coherent answer to that, and we can explain. And so going along with being able to explain how it works, it helps us to develop better protocols to address different conditions. And then also for me as a representative of a laser company, it helps us to build better equipment so that our practitioners are getting the best clinical outcomes. So it's really been quite a journey. And I could just go on and on. It's been a wonderful journey.
It's so fascinating because I remember listening to one of your interviews and talking about how like we had no idea how it worked, but it worked. It works. And it was, I think there is a certain leap of faith around this. I think, well, not so much these days because there is such a body of evidence now that we just can't ignore. But I think, you know, you were one of the pioneers really of, you know, because it is, you're taking a bit of a chance. You already have an established practice, and now you're bringing this new modality in, and you're wondering, is it actually going to do what I think it'll do? So it is fascinating. I'd love to hear how people found their way to laser. So will you tell us a little bit about, I guess, what are the differences between, because I think there's so much confusion out there around what's an LED, what is a laser, is there a difference? Would you mind kind of sharing your insights on what is it?
Let's cover that a little bit. First off, and honestly, Tracy, I try not to let the physics teacher in me jump out too much because I almost want to pull out a whiteboard and start doing diagrams here. But
I get it.
So laser light is special because the light that's produced by the medium, whatever it is that's creating the laser light is coherent. And coherent means that the light waves match up with each other in space and in time. That is a feature that is unique to laser light. And we call it the medium. That is it's like the light bulb. That's what's producing the laser light. Lasers can be produced by either a solid, a liquid, or a gas. Typically in laser therapy, we are using semiconductor diodes to create that laser light that then gets delivered to the patient. So the important thing to know is that laser light is coherent, and one thing that does is it allows us to pass it through a lens, and then you can focus that laser light on a small spot across the room or across the street or even on the moon. Okay, so in our therapy laser devices, we are using that coherent light. The difference with LEDs, light-emitting diodes, the light produced by a light-emitting diode is non-coherent. And so a couple of things, because of that, the LED light will not penetrate as deeply into the tissues, but then also there's a lot more scatter involved with light-emitting diodes. So I always point back to one of the very first textbooks written on the topic of laser therapy. It was written by two gentlemen named Lars Hode and Jan Thune from Sweden, and they analyzed all of the published studies comparing lasers and LEDs, and they found that laser wins every time. Now, that does not mean that LED light is bad. LED light has a certain place in healthcare. However, if it is a focused treatment that is being done on the body for a musculoskeletal complaint or a particular type of injury, laser will be superior for that focused treatment. And then also, I think we are seeing, and we were having a little conversation about this, some of the manufacturers and promoters of some of the LED devices are maybe stretching it a little bit when it comes to their claims made for conditions that they are able to treat and outcomes with their devices. So just to summarize real quick, when it comes to a specific treatment on the body, whether it is for a specific treatment, specific injury, a certain condition, ache or pain, low back pain, Bell's palsy, trigeminal neuralgia, things throughout the body, the class 4 laser will be superior for that treatment of that condition. Whereas the light emitting diodes, and typically they're put into a bed format where the patient will lay in the bed completely exposed, so they are getting more of a systemic treatment. Those are wonderful devices to help with overall health, systemic wellness, improving sleep patterns, things of that nature. So,
And thank you for explaining that. So the coherence of the light. So and if I understand correctly, with the LEDs, like especially if you're talking about like panels and things, you have, I guess, the distance becomes a bit of a barrier, literally, because you can't like be lying on top of it. Well, I know some people do just to try and, because the idea that more is always going to be better. So you have I guess the light reflects off the body then, and we're not getting that deep penetration when we're using like the panels and pads and things.
right, yeah, and well, first off, when you're using any type of light therapy, it has to be directly exposed on the skin. Whether it's LED or laser, it's not going to go through any clothing or bandages or casts or anything of that nature. It has to be directly on the skin. And then, yes, this is where it gets into the importance of understanding all of the parameters involved. And one concept is power density, which is the concentration of the laser light. So with the device is called whole body photobiomodulation, where you are unclothed and you're laying in the bed. The power density in those cases is about 125 milliwatts per square centimeter. That's just a measure that the number really is important. But then with some of the various panel devices, that power density is much, much lower. And then what's even more frustrating is when they demonstrate those panel devices being used, someone is fully clothed. Okay, so you have to have some understanding of the different parameters, and I realize it can get confusing when we talk about power density and dosage and wavelength and power. There's a lot there to it, but it is important to have some basic grasp of those concepts so you can make good decisions about using a particular piece of equipment.
Ready to meet your baby sooner? At Solasta in Round Rock, Texas, we specialize in laser therapy for fertility. This safe, therapeutic laser treatment improves egg quality, balances hormones, and helps create a richer uterine lining for implantation. So whether you're trying to conceive naturally or need support for your next IVF cycle, our personalized protocols and treatments are designed to optimize your chances of success. If you're ready to take the next step, visit us at solasta.health to schedule your consultation. At Solasta, we're here to light the way on your path to parenthood. And can you explain to me what is Speckle when it comes to using lasers? Because when I was talking to someone recently, and again, we were kind of debating LED versus laser, and I was like, oh yeah, but what about Speckle? Because from my understanding, you don't get that with the LEDs, and it is like it helps, I guess, the therapy works deeper in the tissues. Is that correct?
Yeah, part of it is the speckle formation is a unique characteristic of laser light, and if you have a laser pointer or something, if you shine, it's easiest to see with a red laser pointer if you shine it on a white piece of paper, and you shine it there and you look at it and it looks like the light is crawling, and that's happening because of you have some areas where there is constructive interference and the light will appear a little bit brighter. And then there's areas of destructive interference where the light will appear a little bit dimmer. Now, the same thing happens in tissue when we shine a laser on tissue. You do get that speckle formation in the tissue. One effect of that is improving, it's called microscopic thermal gradients. Okay, so if you have an area where the light through constructive interference is a little bit brighter, that means those cells will be getting warmed up a little bit more, and then in areas where there's destructive interference, it will be a little bit cooler, and things always flow from hot to cold. Okay, so in that area where we are shining the therapeutic laser, we're getting that speckle formation in the tissue, and we are improving microcirculation in the tissues because of that speckle formation. But
yeah, it is.
Another part of it with the laser is that coherence of the laser light. It is going to make that laser light penetrate more deeply into the tissue. And you can just imagine if you can easily picture a laser pointer and being able to shine a laser pointer across the room. Whereas if you had a pad of LEDs on one side of the room, you're not going to see anything on the other side of the room because that light is really allowed to disperse.
Fascinating. And I think the more I kind of dive into the physics of it, the more I'm like, it's fascinating. But when last year, the year before, when I started kind of got interested really in mitochondrial health, before I even kind of took a dive into red light and understanding the electron chain or the electron transport chain. Right. And I thought, I'm never going to be able to understand this. But then I realized that's only one tiny part of it. Yes. When you see that once that light is absorbed by the chromophore, like that knock-on effect it has is just, I say it's magic, but when I started looking at the class 4 laser and when I saw the results of especially wound healing in particular, because in my work with women and their partners who are dealing with fertility challenges, we can talk a lot about the different challenges, but it's hard to see the results. You're kind of trusting that it's working and it's supporting your body and supporting your reproductive health. But when you see what it can do with wound healing, especially chronic wounds, you cannot deny that it's not having this really powerful impact on the cells. But one thing that I hear this every so often is, and I think I'm paraphrasing this, I think it might be Tina Cruitt that said, like a photon is a photon is a photon. The body doesn't care where the light comes from, as long as we trigger that is absorbed by the chromophore, the specific chromophore. And I think that is true. And correct me if I'm misunderstanding it, but you have to actually get the power, get the stimulus to the cells. So that's why, again, the difference in, yes, the body doesn't care where the light comes from, really. But if you're talking about the ovaries or the endometrium, we need to get deep into the body. And I appreciate you saying that, LEDs have a place. And I work with women who use LEDs and they'll use it I think of it as it's like your over the counter little bit of support for your physical health. But when you have a problem, you have endometriosis or you have PCOS or something else is going on, it makes sense that you get a tailored prescription for what you're dealing with. So I think for most women, if they're trying to get pregnant and they have some LEDs at home, some pads, whatever, I think absolutely use what you have. But if you do have a diagnosis or there's something else going on and it has been a while and you're not getting any answers, laser could definitely be something that can really accelerate that, family planning. But will you talk to me a little bit about some of, I guess, the most memorable case studies that you've experienced working with the class 4?
So really that can reach anywhere from head to toe and realize that, my experience is more with chiropractic and pain management and sports injuries and things of that nature. So I'm just going to go from head to toe. All right. Just very quickly. So first off, trigeminal neuralgia is a condition affecting the 3 branches of the trigeminal nerve in the face. It can cause severe, chronic 24 hours a day, 7 days a week pain for the patient. It's nicknamed the suicide disease because when someone suffers from it for a period of time, they are seriously considering suicide as an option, as their way out to end their pain. And over the years, having done this for almost 20 years, I've heard from so many different doctors on different conditions. And most often, if we can get them through a series of 10 treatments with the class 4 therapeutic laser, we can almost completely remove their pain. And it's so amazing that we are able to restore their quality of life, get them off the opioid pain medications, and so forth. We've had cases with Bell's palsy, the drooping with the eyelid and mouth on one side of the face. Bell's palsy is a very socially embarrassing condition to have because you can't go out to eat with people, because if you try to take a drink or you try to eat food, because of the paralysis on one side of your mouth, stuff will just fall out. And so with Bell's palsy, the sooner we can treat the patient, the quicker we will get them out of it. But then we have also had cases of people with chronic Bell's palsy lasting for years, and they were told that they would have to just live with it, and we can laser them and get restoration of function there. So just real quickly, what is the mechanism there? There is some theories that say that some of those neurological conditions are actually an activation of a virus inside of the nerve. Everybody's familiar with shingles and chicken pox and how that is an activation of a virus in the dorsal root ganglion of the spinal nerves. But then also, I think some of our cases of Bell's palsy and trigeminal neuralgia are involving a viral component. And the cool thing about laser, that there are so many things happening at the same time with laser therapy. And one of those things is it stimulates a normal local immune response so that the body is able to fight that virus, okay? And kind of reaching back to what you said earlier, about the photons, what I like to say is photons are dumb. Photons don't know what they're doing. They just get shot out of the laser and into the tissues. And the cool thing is that when that energy from the photon is delivered to the body, it is our body's innate intelligence that we are self-healing organisms. And that kind of goes back to that's a fundamental tenet in chiropractic philosophy. And I think other healing philosophies realize that, oftentimes the body doesn't need help. It just needs removal of the interference. And we need to allow the body to do the things that it normally can do. So let me just continue on down the body here. I mean, certainly we could talk about aches and pains all throughout the body, shoulders and things of that nature. But another one that I do want to talk about is various lung conditions. And so this was an accidental discovery with laser therapy. We had no idea that this was going to happen. 10 years ago, there was a chiropractor from California named Dr. Andy Hall, who was diagnosed with idiopathic pulmonary fibrosis. He was told, you'll be dead within 5 years. And so just rationalizing that, hey, I've got nothing to lose, he turned on his class 4 laser and started to laser his lungs. Cut to the end of the story, or to the happy end of the story here. 10 years later, Dr. Hall is alive. He has given advice to scores of doctors around the world, and we have hundreds, maybe we're approaching thousands of patients now that have benefited from this treatment for the lungs. And it's so fascinating. But what it goes back to is, in the mechanism of laser is, we call it photobiomodulation, because it's able to modulate those weird, aberrant, inflammatory responses in the tissues. So with these lung conditions, we can laser them, and we're not curing the disease. We're not, they're not completely healed, but they are in recovery. We are able to improve the function of their lungs, the exchange of gases across the alveoli, and to give them quality of life. So then, continuing on down the body, in the viscera. And see, the cool thing about laser therapy is we can pretty much use the laser anywhere in the body. The only thing we are not going to do, we are not going to shine the laser directly in the eye. However, we can give nice benefit for tension headache, migraine headache, sinus conditions. We can treat elsewhere. We can use the laser over the brain. We can use the laser over the gut and over the sex organs. So the cool thing about laser using red and infrared laser light is it's non-ionizing and therefore very, very safe. So then in the various gut conditions, we do have some female chiropractors that are, they do have a women's health clinic that is based in chiropractic, but they tell me, different cases involving endometriosis or pain associated with ovarian cysts, or even things like irritable bowel disease and constipation that the laser is able to help. So, we could, talk about the mechanisms involved there, but again, we can use the laser over the gut. And then I'll just finish with peripheral neuropathy. So actually this coming weekend, we are teaching a weekend class on managing peripheral neuropathy patients with the laser. And, peripheral neuropathy can be caused by diabetes or chemotherapy or alcoholism, or there are, many other causes associated with it, but really the primary one is diabetes. And, everybody knows diabetes is a massive problem in the US and around the world, and it's not going away. And the interesting thing about diabetic peripheral neuropathy is the answer for modern medicine is to give them a prescription for Lyrica or a Cymbalta or opioids. Modern medicine does not have an answer for diabetic peripheral neuropathy. Whereas when we laser these patients that have diabetic neuropathy, about 90% of them will get significant reduction in the neuropathy symptoms. They will get restoration of the feeling in the bottom of their feet. They will not have the pins and needles feeling. They will be able to walk with a steady balance. They can feel the brake pedal in the car. But then also, you were mentioning the wounds a little while ago. We have some dramatic cases of wound healing that we know that we can attribute directly to the laser, and even cases where we can document that we prevented amputations. I mean, these patients were scheduled to have a foot amputated. We get them through a program of care with the laser, typically 16 to 18 treatments with the laser, and those wounds in the leg and foot are completely healed up. So there are so many exciting things that we can do with the laser from head to toe, and I think it's so cool. I mean, when we first connected, Tracy, I thought it was so amazing and fascinating of your interest in using laser for fertility issues and other things of that nature. So I'm looking forward to continuing a collaboration with you and learning about how you can use these treatments for your patients.
Yeah, and I guess my focus being mostly, I think you start off with one focus and then it kind of, expands based on, what's presented to you. But so for the fertility and then postpartum health as well, for especially here in the US, we have women that, have a baby on Monday and literally 2 weeks later or 3 weeks later, they're expected to be back at work. And they may have had a really difficult birth. They may have had a cesarean and then maybe they're trying to get breastfeeding going. So when I started looking at the research around postpartum recovery, I thought, okay, why isn't every midwife on the planet talking about this? This just makes no sense. And then when I started to see the results for myself, like the wound healing, the scar healing, like beautiful, and no need for, heavy medication. Women who have just had a baby and are breastfeeding, they don't want to be taking really heavy medication, if at all. So when I could see like the pain level being managed really well, and then for breastfeeding, and which is quite interesting because for women who are starting breastfeeding and if they're already in discomfort, the idea of putting a laser on it is not something that they're not volunteering for that until they understand, and it's not like a James Bond laser that it's not going to do any damage. So for me, the women's health aspect, menopause, there's so many applications. And I think because there's so many applications, I think people do think, oh, it sounds like it can't possibly do all of that. But it does, because it does that one thing really well. And that's, powering up the mitochondria and that ATP. But I think the more I've been working in the fertility space, and I see ATP is that's just the beginning. When we see like the cytokines and how the embryo is talking to the uterus, and if we have to have all of these in place, or else implantation doesn't happen. So you're working with, you're trying to make sure we've got really, juicy eggs, and we want to have a really juicy endometrium. But we've got problems on either side, and we know that the laser can help all of these different aspects, and especially with the increase in circulation. There's just, I could sit here and talk all day just about the fertility part of it because it's so exciting. And I think we're at a point in kind of, fertility treatments where, again, there's no guarantees. There's only so much they can do. And I was recently listening to a podcast about starting like stem cell therapy and how this is a PRP. This is an aspect that is being offered in fertility treatment now. And I thought, okay, so yes, we could go through, taking my blood, spinning my blood, taking out all those lovely stem cells and putting them back in. Or we could do a little laser, because we can see that laser, especially on certain bones, can increase stem cell production by almost like 300%. So for me, I'm like, is there anything it doesn't do? And I haven't found it yet. So for support for fertility, women's health, I think it is such a brilliant time, I think, to be involved in women's health, to see this really emerging. But as I was mentioning about the, women who are having nipple distress are not really keen on the idea of a laser. So would you just talk a little bit about the safety of therapeutic laser? Because I think that is a big worry that, it's going to hurt, or what are your experiences around, again, the safety and what should people expect when they go for their treatments?
Yeah, I think the one of the best analogies that I've heard, and actually I'm going to use my metal ruler. I forgot to I was going to use a steak knife to show this, but here's a metal ruler. It's got a flat side and it has a sharp side. Okay, if I take it with the sharp side and I push it on my skin, that hurts. And that is an analogy to a surgical laser, a laser that is able to cut tissue. But if I take this ruler and put the flat side on my skin and press, that feels good because the pressure is spread out over a wide area. And that's what we do with therapeutic laser. With the class 4 laser device, it is not a focused beam coming out of the laser device. It is spread out to a large spot size, maybe about the diameter of a golf ball or so. There are different size attachments that we use on the laser device. And so the laser treatments, wherever we give them in the body, they are non-invasive, they are non-ablative, meaning that they do not cut the skin. The power density or the concentration of the laser light is very low, so there is either zero tissue heating or maybe just a little minor, a degree or two of tissue heating. Like for example, in my chiropractic days, when I would work on people's low back, we're using higher power to treat the low back, and the low back would get a little bit warm. It's very soothing and very comfortable, and I would have patients that would fall asleep on the table because it felt so good. So when we go back to, if we're talking about treating the breast for either cracked nipples or blocked mammary ducts or anything of that nature, again, just to reassure you that laser light, it's spread out to a large spot size, it's at a low concentration, and we're using red and infrared laser light, so it's an entirely safe treatment. And so I think back to, it's been several years ago that I was first asked the question about, can laser therapy help with cracked nipples? And I'm a guy, I have no idea what that feels like. And so I asked this chiropractor, is a friend of mine, and I asked her, what does that feel like? And she says, well, imagine that the baby has a mouthful of broken glass and they're chomping on your nipple. I mean, I can only imagine how painful that would be. And I think it's always, important for us to think about the big picture of things, think about how that affects the mother's relationship with the child. And I'm sure that you could go on and on much more about that. So when I was asked that question, I said, and anytime I'm asked a question that I don't know, I say, I don't know, but let's try this. And again, what's so cool about laser is almost every single time that something like that happens, it worked. Okay. So I gave the chiropractor some recommendations for a setting to use with the laser, with the power and the dosage and things of that nature. She called me back the next day and said that not only was the nipple pain-free, but the cracks in the nipple were completely healed up. And when you think about it, that's very, very biologically active tissue. So when we apply the laser on there, we are stimulating that tissue healing. And I was just thrilled to hear that. I thought that was just fascinating. But then also what was interesting, we reached out, I contacted her a few months afterwards, and she says she has patients that would undergo regular care for cracked nipples or blocked mammary ducts, and they were finding that their milk production was increasing. And one thing we can be reassured of is it's very safe, going back to the understanding that we're using red and infrared laser light, but then also because of that increase in circulation to the mammary ducts, and the mothers were able to produce more, they were able to feed the baby, pump and save some, and either save it for their later use or, more importantly, donate to a milk bank in the area. So wow. It was just such it was a win, 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 win. Everything about it was a win, and it's just fascinating.
Absolutely. That's fantastic. Yeah, because it's not just that, the mother baby experience, is that like it has a knock-on effect, and that's actually impacting in her community, which is incredible. Because the thing about, especially like specifically for the nipple pain, breastfeeding related, it's so you have that glass metaphor. But unlike another injury where you have one injury and then you're dealing with that injury, you're feeding your baby multiple times a day, especially in the very beginning. So there's such a fear and totally understandable fear of, I have to do this maybe 8 to 12 times a day for the next couple of weeks. How am I going to do it? And that's why one of the reasons why so many women stopped breastfeeding before they were really ready to was because they felt like they had no choice. The pain was just unbearable for them. But I've seen some lovely research on this that, again, showing, of course, the milk is going to increase because the baby's at the breast more, taking more off, so the body's going to respond in a really nice way. So it's and with the treatments for nipple issues, it's fairly quick. Like it's 5 minutes, not even 5 minutes. So it's really quick. It's so effective, and I know there's some lactation consultants in Ireland that are currently using it, and there's nobody here in my local community doing it. So I'm hoping that as I connect more with the doulas and midwives in the area, that they'll see the benefit as well. So at the moment, I think there's a lot of talk around using laser for brain health, but what's coming up for you that's exciting you about the field of PBM?
For brain health, there's a lot of questions that we don't know the answer to yet. And also, one thing that I think about here is I wish that PBM was a one-stop fix for conditions like Alzheimer's. But we have to realize, and the phrase that's been rolling around in my head the last few days is, Alzheimer's is not an ankle sprain. Alzheimer's, and I took a wonderful seminar on the topic a couple of weeks ago from a top chiropractic neurologist in the U.S., and he points out that if we're talking specifically about Alzheimer's or other neurodegenerative conditions, first off, there's going to be genetic components to it that increase our risk, and there are certain genes that dramatically increase your risk of getting Alzheimer's. And as fantastic as laser therapy is, laser therapy cannot alter your genes. It's not going to change your genetic structure. But then also there are things that happen, they could have been happening 30 or 40 years before we actually noticed the symptomatology of Alzheimer's disease. And again, as wonderful as laser therapy is, it is not going to correct those problems that have been happening for 30 years. So I encourage anyone, if we're specifically talking about the topic of Alzheimer's, there is a specific program, and I'm going to pull up the study here real quick because I forget the guy's name off the top of my head. Dale Bredesen. There are specific protocols. The doctor's name is Dale Bredesen, Bredeson, and he looks at all of the factors involved in Alzheimer's disease. So again, I wish that PBM would be a one-shot fix for things like Alzheimer's, but we have to understand it's a multifactorial condition. Okay, so I just wanted to make sure I got that in, because I think sometimes when we talk about laser, maybe we can be a little bit too rambunctious in the claims that we make. And because my own mother passed away from Alzheimer's, I mean, I certainly do have that possibility of that genetic component, but I also don't want to be offering any false hope to anyone who is dealing with Alzheimer's in their life. I want to look up the Dale Bredesen protocols, and that's really a much better solution. But then just kind of jumping back to brain health in general. First off, when we laser over the brain, for example, I would not laser myself today because I put some product in my hair. We have to make sure the hair is clean and dry, so we have to take care of that first. And then also when we laser over the brain, we have to make sure that there is no active bleeding in the brain. For example, sports injuries, concussions, motor vehicle accidents. We have to do a CT exam with contrast to make sure that there is no active bleeding in the brain, because transcranial infrared laser is proven to increase circulation in the brain, and we don't want to make any situation worse there. But then beyond that, we are getting individual clinical cases, and there are getting to be some more studies published on various conditions, such as, with Parkinson's. Individually, in some clinics, we have had some interesting outcomes with Parkinson's patients, reducing the resting tremor, fixing the steppage gait, and so that it's made a dramatic impact on their lives. Conditions such as brain-related injuries, whether it is autism or ADHD or things of that nature, we do have some practitioners that are developing protocols there and getting some very interesting outcomes with patients. And then also just kind of a general cognitive abilities. There are some interesting studies that show that when we laser the brain, we can actually improve executive function of the brain. And not to guarantee that we're going to improve anyone's IQ with laser treatments, but it's interesting that all of these things that we talk about with the laser of improving circulation, improving tissue oxygenation, improving metabolic activity in the cells so that the cells are functioning more normally or the way that they should be. There are a lot of potential applications for laser treatment in the brain. And so a lot of research has to be done. Obviously, when we laser the brain, we are going through bone. The studies that I've seen show that when we shine the laser externally through the skull, about 3 to 10% of the light that we shine on the skull can actually get through that bone. So there has to be a lot of work done as far as developing appropriate protocols and things of that nature. But the whole area of using laser and light therapy for brain health that's very, very interesting.
Yeah, it's again like a fascinating area, but I think again there's a fear around. I'm going to put it on here, and it's what is it going to do to my? Yeah, I think there is a little fear around lasers and brain health. I think again, like I can shine it on my arm and I can see what's happening. I can feel, but I'm like, do I put it on my brain and hope for the best? And so you would definitely recommend having a protocol and following the evidence when it comes to, especially around brain health? Or do you think because the biohackers are out there saying, yeah, just, throw a laser on and, hope for the best. And I'm like, no, that's not really a scientific way or a safe way of doing it.
Right. Yeah. A part of it when we, at least when I talk about following the science, a lot of times published laser studies are about 5 to 10 years behind what we are actually doing in laser therapy. So right now, I'll just pick neuropathy. Right now, I'm aware there's like 2 or 3 published studies on class 4 laser for peripheral neuropathy. But our doctors where we teach the seminar and they follow our laser protocols, they are getting those 90+% rates at significant reduction in neuropathy symptoms. And when it comes to brain health, it's important to think about proper parameters. In addition to the amount of light getting through, how we deliver the light through the brain is important. And what I'm getting at there is whether we use continuous wave where the light is constantly on, or if we are using pulse frequencies. And so if that laser light is flashing on and off, especially when we treat over the brain, what we find is that it can actually stimulate the different types of brain waves, the alpha, beta, theta, the different types of brain waves. So depending on the clinical presentation of the patient, then we would use a different pulse frequency so that we are stimulating the appropriate brain waves in those patients. So yeah, it's not a matter of just grabbing something online and whipping it out of the box and throwing it on. It really is important to have that understanding of the parameters and looking at things in an appropriate way. And then also, me as a former practicing chiropractic physician and now as the medical director for a laser company, I like it that that the awareness of photobiomodulation is improving, that more and more people are aware of it. It's getting more publicity on social media and other venues. But the frustrating thing for me is that seeing devices that a lot of it is going to be home use devices that simply are not able to stand up to the claims. And so when I talk about a class 4 laser, a class 4 laser is a prescription medical device that is going to be used by a licensed and trained healthcare provider in a healthcare clinic. So yeah, I mean, it's just important to understand that there are certain devices that do have, some devices can have a place for home use, but for the most part, if you really want to get the best results, it's just important to invest in going to a healthcare provider that offers this service and let them do the treatments at the office there.
Yeah, I think personally, as much as I know now about laser and photobiomodulation, and I wouldn't be keen on treating myself. I want to go somewhere that somebody who, because I know a lot about fertility and breastfeeding and women's health, but when it comes to the brain, yeah, I want to go to an expert who can tailor a plan really for my health goals.
Yeah, and that's something that please understand. I do tag myself the world's foremost proponent of class 4 laser therapy. I do that partly tongue in cheek. I mean, I have, my ego is about this big, Tracy. But I think it's just the fact that I've been able to do this for so long and talk to so many people, and I've been able to travel to almost 30 countries around the world and visit with practitioners, and just being able to get all of this feedback from all the practitioners that I get. And so I always like to be immediately available. If somebody has a question about, this patient presents with this condition, what do I do with the laser? And yes, I do represent a certain laser company. However, I get laser questions from all sorts of people, and I'm more than happy, the best of my ability. I want to get those questions answered quickly. So a question that came to me this morning was, 10-year-old patient, I don't know the circumstances, but there was some carbon dioxide exposure to this 10-year-old, and now they have lost a significant amount of their memory. What do we do with the laser? Well, first off, I'm always going to say we can't promise anything outcome here. However, we can promise that the treatments with the laser are going to be non-invasive and they may potentially help. So we just talk about what are some areas that could be affected in the brain. It might be beneficial to do a treatment to the cervical spine to improve blood flow to the brain. And so again, whether it's that or I do get plenty of questions from anybody asking about any condition from head to toe, and I'm just more than happy to answer those questions.
So on your travels, before I let you go, I wanted to ask you, so it's the US and I guess from what I know about Ireland as well, where they're just starting to realize, I guess, the benefits of PBM. More so kind of on the consumer end. When I went to the PBM conference in London earlier on this year, and it was fascinating to meet like so many of the scientists from Brazil and all over the world who, they're not out there designing products as such, they're just doing the hard science. But on your travels, like which countries do you see have really see laser as, it's part of our healthcare system, or it's very common compared to kind of what we see here in the US, where it seems like people really have to go seek you out to find laser therapy here?
Well, Tracy, first off, I'm going to say I'm a little bit hurt that you didn't stop by. I was at that conference in London, and I'm amazed that I didn't see you. I could see. I mean, we were there. Our company had a booth, so I didn't go. I went to a couple of the classes, but for the most part, I was just standing in our booth there. But that's quite an organization. As far as acceptance of laser in the different countries. I don't know. I think compared to other countries, I think in the U.S. it is because in my experience, we started out in chiropractic, and then early on we connected with some people who were distributing the equipment in veterinary medicine. So we've got that whole issue of the use of laser on animals. But then in the last 5 or 10 years, what I have observed is I've seen a tremendous increase in interest in laser therapy from pain management doctors, medical doctors who are willing to think outside of the box, but then especially athletic trainers, sports trainers So what I see with us is we have a lot of the professional and college sports teams that are using our equipment or other brands of laser equipment. And it's kind of funny how different professions, right now we're at the stage with physical therapists. Physical therapists are still very, very skeptical. They need to see a lot more published studies, and we're getting there, and that's great. But then, just thinking about going to other countries, I'll be going to Malaysia in May, and in Malaysia and throughout Southeast Asia, we're seeing a tremendous explosion of use of the laser. And what's interesting there is, like, here in the US, it's primarily going to be individual clinics using the equipment, whereas in Southeast Asia, it's more of the hospitals that are using the equipment. So I guess that the optimistic thing, the cool thing is that the interest in the awareness and the applications of the laser, it's always continuing to grow. Laser is always going to be here.
Yeah. And it's such an exciting, I think it's such an exciting time to be a midwife and to be involved, for anyone who's involved in women's health, because women's health tends to be like, we're not, mini men, but sometimes the research doesn't reflect really what the unique needs of women. So I'm really excited about kind of where this is going to go the next couple of years. And as you said, like, we're behind on the research, and even, it's trying to when I started looking at the fertility research, and everyone talks about kind of, two kind of sets of data, the Oshiro protocols in Japan and the Giga laser, the Anne-Marie Jensen, and really great collections of data and great outcomes. But it was only when I started to dig in and using Google Translate to find there's so many Japanese papers and there's so many Brazilian papers that it's that's just, you guys sent me down a million other rabbit holes of translating research. But knowing that it's happening and knowing that this is, a kind of standard of care in other countries for women who are having fertility challenges. Dr. Phil, thank you so much for joining me today. I could chat all day, and but I know you have other things to do for the rest of the day. And but yes, thanks so much. Would you like to share where people can reach you?
First off, I'm just wonderful conversation, Tracy, and I'm really looking forward to continuing conversations with you. And the next PBM conference, I think, is going to be in South Korea. Are you planning to go there? Or,
I am indeed. Yes. Well, global events permitting. Yes, I do plan. Yeah.
Yep. So, but anyway, for myself, I have a personal website where I have a lot of information posted. It's drphilharrington.com, drphilharrington.com. And from there, you can get links to my social media outlets. On Facebook, on my professional Facebook page, I primarily post articles that I write about laser therapy. And then also kind of a side hobby that I have is using Canva to make social media pictures for Facebook and Instagram, so you can check those out. I have a lot of information on my website. And then I also am working on, and I have to get like a cattle prod or something and prod myself, because I've got a book in the works, and I need to get it published because it needs to get out there. And it's simply going to be a clinical handbook for class 4 laser therapy, because there's really nothing out there that I can see specifically focused on class 4 laser therapy. So yeah, my personal website, drphilharrington.com, is going to be the best resource, and then links to all of my social media pages are off of that.
Thank you so much, and I'll include all of the details and all the links in the show notes. So thanks again for joining me. I am looking forward to having lots more discussions and no doubt a million more email exchanges over the next couple of months. So thanks again.
I'm tickled to learn from you about, you're one of the biggest fans that I've found when it comes to the use of laser for fertility and other issues. So I'm really looking forward to learning from you also.
Yeah, we've got lots of sharing to do, and I might have to get out to Malaysia one of these days, and because this fertility, it is a global phenomenon that our fertility rates are tanking, and we need to figure out a way to repopulate the planet. So
Yes.
that's my goal, just to repopulate the planet. No ego there at all. Thank you, Dr. Phil.
Okay.
Thank you so much for tuning in to today's episode. Remember, empowerment begins with knowledge. If you enjoyed our time together and want more content like this, don't forget to like, subscribe, and share with your friends. So stay inspired, stay informed, and until next time, take care of yourself.